Hi, I'm Lori Most, founder and CEO of Binary Bridge. Our product, Backpack EMR, is currently being used by 17 health organizations across 21 countries. And we are here at the Global Health and Innovation Conference looking for other health organizations who could benefit from a tool like Backpack EMR. But we're also looking for collaboration opportunities with other innovative technology, training, or medical device providers. In 2013, I saw firsthand how a lack of access to healthcare in rural areas affected the communities as a whole, and I was fortunate to see several medical professionals from the US working to help. I wanted to help improve the quality of care they were bringing with better data capture, stronger data security, better patient privacy, increased data accessibility, and automated trending metrics and follow-up reports, all things that we take for granted here in the States. This would be, of course, digital patient health records. So just like many others, we searched for an EMR that could run without dependency on the internet or electricity, both of which we weren't guaranteed to have in these rural communities. We couldn't find one, so we built an EMR that can share data with many devices at the same time without requiring a centralized server. So either locally located, which would require electricity, or in the cloud, which would require the internet. We built a serverless, offline data sharing network within our app, Backpack EMR. We've had up to 20 tablets used in a large clinic that included 8 different stations, including registration, vitals, cancer screening, labs, exams, and pharmacy. And we saw 1,000 patients over 2 days where we had no access to the internet or electricity. The next day, we were able to auto-generate reports. We gave a report to the community health workers that could guide their health education based on the high incidence of respiratory tract infections. Additionally, we sent the aggregated data to the Ministry of Health to help them determine additional resources for the region. We also provided the medical team there with follow-up reports and trending statistics to help guide their follow-up clinics. All of this would usually take months to accomplish with paper records. We also left tablets with the local team so that they could have access to the patient's files while following up on their visit, adding new information to the patient file while still offline. So when they would have then access to the internet, the new information is sent to our cloud backup. And over the past year, COVID strengthened the case for digital health records and increased our focus on local development by shining a light on some of those challenges of healthcare aid that relied on foreign medical professionals to run in-person clinics. So we started a focus on remote ways to bring healthcare to underserved locations with asynchronous virtual care and remote clinician-to-clinician training and mentorship. With more focus on local leadership driving health outcomes, we also want to integrate with portable AI-enabled diagnostics so that we can put more control in the hands of local health workers. We'll also build in our own predictive analytics to help guide basic diagnosis locally. So we are here today looking for partners with similar focus, specifically other teams working on AI and predictive analytics around diagnosis and treatment plans, along with portable diagnostic devices that can integrate with our system and enhance our impact. We are also looking for implementation partners whose medical teams could benefit from a serverless digital tracking system like Backpack EMR. So we were able to run a pilot series of clinics to test out our offline-online virtual care platform with 2 of our partner organizations last year in Sierra Leone. One was the African Christian Fellowship, which is based in the US, but has a strong local team on the ground in Sierra Leone. They typically supplement their medical team of local nurses with physicians from Nigeria and the US, but because of COVID travel restrictions, they were unable to attend. Our second partner, Blessings International, was able to send certified medications directly to Sierra Leone to ensure that the prescribed medications were safe and effective. So now I'd like you to hear directly from them how this pilot went.
Well, I'm Barry Avey. I'm the CEO of Blessings International. I've been a pharmacist since 1993, so it's been a while now. Received my doctor of pharmacy from the University of Arkansas way back, and have been fortunate to be able to use that as well as received a law degree in 97, and have used those both together to really work to help Blessings on the regulatory side as well as on just the operational side and trying to grow what we do each and every day. So over the last year, Blessings has been fortunate to be able to continue to impact worldwide through the shipment of medicine, either directly or our work here in the US as well. But we have what we call a human treatment value And that's how we measure what it is that we're doing. This last fiscal year for us, which was September 1 through August 31, we had a human treatment value of around 94, 95 million. And so when we do the math on that, we come to an estimated number of lives touched of around 4 million people. And so when COVID started, we ended up reducing the order size that we could ship throughout the world, worked with a couple of shipping companies to decrease the cost of shipping so that we were able to be more effective in what we did. And so it was a great combination working with Back EMR that then developed into some work with African Christian Fellowship that we were able to all work together to help them put on a virtual clinic. We sent the medicines, and it was a lot of medicines that a typical short-term team would bring in. Chronic medicines, like things, again, for diabetes, high blood pressure, but also things that are needed for short-term items like acetaminophen and ibuprofen. So those things that we can run to the store and get at any time, but in a place like Sierra Leone, they don't always have quick, easy access to it that's high quality.
Back, the African Christian Fellowship is an organization here in the US. We also have branches in the UK. And it was basically started by African students who came to the US and who wanted to be able to maintain at least some fellowship and together. And so the African Christian Fellowship, one of the tenets of the organization is to give back to Africa, to build bridges back with Africa, and to see how we can impact Africa for Christ.
But normally they will go into the villages and communities just trying to help people. But by the grace of God, we were able to raise up that clinic in 2014. But then the Ebola struck, so we couldn't continue with the clinic. But the clinic was reopened again in 2016. Yeah, and all that. But that's not the only aspect where ACF has really, really been helpful. They also started going to the provinces, to far villages, 5 hours away, 6 hours away, 3 hours away, just to do medical outreaches, especially where you don't have any form of medical intervention. Nothing. I mean, nothing. In fact, one of the outreaches we had, the people had to trek 2 hours from their village to a point where we met with them. We trekked 2 days just to see a doctor. So that's how serious the situations are here. So I'm not just talking about towns, I'm talking about right there in the village where we don't have any form of medical intervention. So they started going to these places and reaching out to the people as well.
And we realized that, in between when we go, the work just could not stop. And COVID made us realize that you can do things by telemedicine.
And it's so easy for us. We're more organized and things went smoothly. For me, that's the first thing that happened, and it's a major breakthrough for us. But it gave us opportunity to talk with doctors from outside Sierra Leone. So we had people who consulted outside Sierra Leone, and it was easy for them because we take the vitals here and impute the information, and they get it over there in US, and then they're able to know who they are talking with, the vital signs and all that about the person, and they know what to say or what to do. So that's another breakthrough. I think the other thing is, okay, there was a time we had an internet breakdown, and the router was able to help us. So we didn't need to worry. All we did was just to switch on the router and all the computers connected, and we still continued with our work. And once we had the internet, I think that was after the whole thing. At the end of the day, everything clicked again when the internet came on. So that was another thing that we enjoyed. Then another thing is documentation. Yeah, so we were able to have documentation of our works. And for me, while reporting, I could play with figures. I could, I could, whether it is to send a graph or a bar chart or whatever, I could do whatever I wanted to do because I had the figures readily available. And there were diverse kinds of information. For example, we had for the sex, that's the number of males that came, number of females that came, number of children. That would have been very, very difficult. We even had to the point of occupation. So this set are farmers, these are drivers and all that. So that really helped us to know maybe you want to do something, you want to relate one thing to the other. That really helped us in doing that. Transparency, yes, transparency and accountability. Yeah, because if you know that somebody in US is out there and knows something that you are doing, you have to do it well. So I told everybody, listen, whatever thing you are sending is not only you that is getting it. So those at the pharmacy, those at the triage, and the doctor himself, and those of us helping out as well, to take information down. We were all very, very serious, knowing that I think it made us more serious because everyone will have a chance to see what you are doing.
So from us, it was amazing for me because on our own side, okay, so we had a doctor from Sierra Leone, that was working on the ground, but then three other doctors, So one person from Nigeria, he was using his phone, and I think he worked all 3 days, if I remember. Then on this side, there were 3 doctors here in the US, and 2 of us are here in Mississippi and 1 in Atlanta. But even one person was a pediatrician. Of course, he was in his own home. He's maybe about 15, 20 minutes from where I live. And of course, I was here, and the other doctor was in Atlanta, and we were able to, for us, the beauty was able to log in and actually see the patient, see the vital signs, see the common complaints, and then we could use video to actually see the patient. Like there were patients like who had a rash. I think her husband and the son, and I was able to see the rash, and I went, okay, this is the illness. And then the medications were in, of course. So when we put in a diagnosis, you could pull up some medication. But for me, that was really incredible that they were over there in Sierra Leone and we could in real time, participate in the care of the patient. And for me, those 2 doctors who participated in real time, they would not have come to Sierra Leone.
Yeah.
Because one of them runs a very busy clinic here, Dr. Obiekwe. But he was able to do that, in between his patients. He didn't, normally he wouldn't come. He hasn't been to Sierra Leone in over 5 years, I think. Mm-hmm. And then the other doctor has never been to Sierra Leone, the pediatrician, Dr. Hosan Azomani. And he participated because he didn't have to, fly or go anywhere. He has a child at home who is doing hybrid learning because of COVID, and his wife works full-time, so he could not have been able to travel. But because of this, he was able to participate. So I think for me, what I saw was that I saw participation from doctors who normally would not have participated if not for this virtual medical missions, And then, like he said, when the internet went down, there was a time we had to just rely on our phone, and then Dr. Victor was the one typing in. But then when the internet came on, we could go in and still see their notes and see what happened. So I think that is incredible. So I know internet connection was one of our major problems, because even though Dr. Victor tried to get a company to establish a good internet connection, we discovered that either due to their lack of towers close to the clinic, it's a rural area, we did not have good internet connection. But then the day that they had the clinic closer to Freetown, I think they had better internet connection. So in 2019, they actually contacted us because some medications were expiring. I'm assuming that many teams could not go on medical missions in 2020, because of the pandemic. And so they contacted us, and of course I contacted them, and they were able to get us the medicines and ship it there. When I went in 2018, I took it there myself, but in 2020, They had to ship it, by DHL, and they shipped it for free. Once we ordered a certain number, I think about 1,500, 1,500 or more, they would ship it for free. And it got to Freetown before the Bechal. So we were really so thrilled that it got there. And I think Victor went and picked it up. Or they sent it to your home.
Yes, they came to the house.
Yes. So that was amazing. Yes, so Blessings International, that has been a great partnership, that they have those medications that we can buy in bulk, and it's quite cheap and it's genuine. Because you may not know, but West Africa, and actually most of sub-Saharan Africa, is plagued with fake medications. Before COVID, it was said that 70% of the medications that go to sub-Saharan Africa are fake. And with the COVID, it actually jumped up to between 80 to 90% of the medications are fake. So for us to be able to get genuine medicines from here, the patients can tell the difference between the genuine medicines and the fake medicines. So actually, they're really very happy that when we can give them medicine. So we thank God for Blessings International.
Counterfeit medicine and substandard medicine have been prevalent in these developing nations for many, many years. But even as prevalent as it's been, some places as high as 65% of their available medicine source is either substandard or counterfeit. We've seen an increase in that because the lack of good quality medicine coming in with the folks that are typically coming, someone again is going to step in and fill that gaps. And unfortunately, it's not been those who have access to good quality medicine. So that's one of the areas that I feel like we've really, again, been able to help and been able to serve in, is by transiting good quality medicine so that those who are being served have what they need and in the manner that they need it.
If you are providing healthcare in rural communities or are running medical outreaches to rural areas and would like to see if Backpack EMR might be a good fit for your organization, please email us at the address below or go to our website to schedule an introductory call. We aren't the right fit for all scenarios, so we'll talk through your clinic requirements and let you know if Backpack EMR is a good fit or if another option might be a better fit. Additionally, if you're part of a medical team that could use access to medical specialists for remote consults or second opinions, we have a growing pool of physicians who can review a patient chart in Backpack EMR securely from their homes and then send feedback to you directly within the chart. And if you are a tech team working on AI or predictive analytics in this space, we'd love to talk more with you about a potential integration or a partnership. If you've got portable diagnostic tools that can be used in pop-up clinics, we'd be very interested in working on a bundled solution for our mobile clinic providers. So many of us are working towards the same goals of increasing access to healthcare and improving the quality of that healthcare. And together we can bolster local development of health workers and truly strengthen healthcare systems with innovation. Thank you.